Congratulations to these phenomenal 2021 Pinnacle Award recipients for demonstrating quality in the medication use process. All are making a positive, lasting impact on the standard of healthcare. Many thanks for all you do. And now, it's my honor to introduce our speaker for the annual Innovation in Pharmacy Lecture. This year's lecture is delivered by Dr. Melissa Somma McGivney, Associate Dean for Community Partnerships and Professor of Pharmacy and Therapeutics at the University of Pittsburgh School of Pharmacy. During the lecture, listeners can submit questions in the GoToWebinar portal, and Melissa will answer them in a short Q&A at the end. The title of Melissa's lecture is Building Partnerships. It's about the people. Please welcome Melissa Somma McGivney.
Thank you to the APHA Foundation for supporting and celebrating advancements in pharmacist-provided care in communities nationwide. On behalf of the University of Pittsburgh School of Pharmacy, the Pennsylvania Pharmacists Association, the Pennsylvania Pharmacists Care Network, and Value Drug, thank you for this incredible honor for this award and to be a part of this invited presentation to share our story. We offer our congratulations to Dr. Janine Abrams for her global leadership in medication management for underserved populations and the team at the University of Michigan Health for their success of their hypertension program. It's an honor to be recognized alongside each of you. My name is Melissa Somma McGivney. I'm a professor, associate dean, and founding member of the Pennsylvania Pharmacists Care Network. And I'm a pharmacist, deeply committed to ensuring that all communities have access to pharmacists in their communities to provide needed care and connections to healthcare resources. My goal today is to share with you the behind-the-scenes story of how we built the Pennsylvania Pharmacists Care Network from a concept to reality of over 170 community pharmacies throughout Pennsylvania, now caring for over 100,000 patients who they've been paid for to provide that care, and providing over 250,000 COVID-19 vaccines since January of 2021. Today is about the people who built this network to serve the people in our communities. For us, it's all about the people. Let me take you back 13 years ago to a fall morning and a drive from Pittsburgh, Pennsylvania to Harrisburg, Pennsylvania. For those of you who know our state, you know that you drive the Pennsylvania Turnpike and you see the beauty of our state along this drive. You begin in an urban environment and then quickly come to suburban locations and then go through the mountains to the farms and the fields and ultimately back to suburban environments and then to an urban location in Harrisburg, Pennsylvania. You see the incredible diversity of our state, the beauty of our state, and yet what you realize is as you get to our state capital and you meet with pharmacists, we're all connected. That day, 13 years ago, we pitched to the Pennsylvania Pharmacists Association Board of Directors to do a survey, something that we do as academics on a regular basis. But this survey was to learn about the interest of pharmacists statewide in developing a patient care network. That study that happened in 2008 to 2009, led by Maria Osborne with funding from the Community Pharmacy Foundation, included 1,700 pharmacists that represented all 64 counties of our state, with 869 pharmacists stating they would join a patient care network. That was lesson number one. Document the need and the interest before moving on. That study sent us on a trajectory to build a network. We had 869 people waiting for us to follow up, and we had our first partner, the Pennsylvania Pharmacists Association. The pharmacists wanted to know, how do we build this network? They were ready, but how? We knew that we needed to have training to start this building of the network. We needed the training in order for us to have a common standard of practice and a common language that included a philosophy of care, a standardized patient care process, and practice management, ways to document and get paid for our services. As Pitt Pharmacy, we set out to engage our next partners like we always do, which are our partners at our 6 other schools of pharmacy in Pennsylvania. We are fortunate to have a diversity of colleges of pharmacy in our state that span the geographies, and together faculty from those 7 schools designed a statewide training program for pharmacists and for students. We received 2 grants to support this development, and we held live training sessions in 4 distinct regions of Pennsylvania. And we did this by partnering with more pharmacists, and it was those leaders in hospital and health systems that provided space for us to be able to hold these live training. The trainings occurred in Lancaster, Mars, Allentown, and Johnstown, Pennsylvania. Together with our faculty colleagues across the state, we trained over 900 pharmacists in the Commonwealth, and we developed a standardized training for students that has been revised and is utilized today in all 7 schools. This was lesson number 2. Work across your pharmacy partners, including academic and health system partners. It amplifies our reach, and it's a lot more fun. It led to so many other connections in our state, really helping us to lead with one voice. We continued the training, and we began thinking about how to build the business infrastructure of the network. In 2010, the inaugural Pennsylvania Pharmacist Care Network strategy meeting took place at the University of Pittsburgh. Pharmacy leaders, including Greg Drew from Value Drug, Adam Welsh, who was serving as the Pennsylvania Pharmacists Association president and faculty at Wilkes University, Pat Epple, CEO of PPA, Bob Begley-Gemini from the Lehigh Valley Health Network, now president of a hospital, Dean Patricia Kroboth from the University of Pittsburgh, and I met together with these leaders to learn from other leaders who are working with pharmacists in employer situations. We met with the Pittsburgh Business Group on Health and the Wisconsin Pharmacy Collaborative to learn their perspectives on how they partnered with employers to have pharmacists provide care. The result of that meeting was to engage another pharmacist leader, patient care consultant, advocate, and professor emeritus at the University of Minnesota, Dr. Linda Strand. She joined us for a 2-day planning workshop back in Harrisburg, Pennsylvania in April of 2011. Her leadership allowed us to design the vision, focus, and principles of the Pennsylvania Pharmacist Care Network that we follow today. The structure included services offered, electronic documentation needs, data analysis, payer sales and contracting, billing, practice development, and organizational funding and organizational design. This was lesson number 3. Gather input, gather it nationwide, and that input collectively leads to innovation locally. We needed to be able to create the change right here in our own state. All of this work positioned us to be ready for an important opportunity that came to us in March of 2013. The Pennsylvania Department of Health approached our state association to join them in the submission of a portion of their Centers for Disease Control CDC 1815 grant. The grant at the time had a portion dedicated to the Million Hearts campaign. The grant was funded by the Pennsylvania Pharmacists Association's partnership as that they were the primary subcontract, and we then partnered with the University of Pittsburgh and other faculty statewide. This grant funding accelerated our partnerships and our growth of the Pennsylvania Pharmacist Care Network. This was lesson number 4. The State Department of Health and CDC grants are important connectors, not only to funding, but to state leaders. It opened doors for us that we weren't able to open alone. Again, partnering is the key. This grant funding with the Department of Health allowed us to start on a wide trajectory of additional partners. As you're thinking through this, what was next? And it was payers. So the very first thing that we did as a part of this funding was to create an invitational partner forum, again, hosted in Harrisburg, Pennsylvania, the central meeting place in our state. It included payers, physicians, and pharmacists across the state in order for us to learn and listen what it would take to partner with payers in Pennsylvania. This was held in April of 2014. The funding allowed us to revise the training that we had, create a more robust training program, and engage all 7 schools of pharmacy again. We were able to utilize the funding to develop a Train the Trainer program, which allowed to have live training sessions on an ongoing basis throughout the state. We also created pharmacist physician mentor teams creating connections between local physicians and pharmacists throughout the state. And we created our first research support team, which was inclusive of individuals from all 7 schools of pharmacy, as well as practitioner leaders in our state. Each of these practice development elements provided essential insight into the needs of healthcare payers and pharmacists in practice. The payers told us some really important things. They needed to have an organized single sign-off mechanism to partner with pharmacies for patient care. They couldn't partner with each pharmacy individually. They needed a centralized way to do that. Payers also expected assurance that patient care would be coordinated and consistent between the pharmacy practices. They wanted to make sure what they were paying for was happening equally throughout the state. And they expected electronic documentation of patient care to allow for quality assurance and evaluation of outcomes. Here comes lesson number 5. Pharmacist to pharmacist connections across settings, including our partnered pharmacists in health insurance and managed care environments, are critical to success. Bridging the profession together moves us together. Coming from the city of bridges here in Pittsburgh, it couldn't be more appropriate. These bridges have been critical for us to create across the entire state, and pharmacist to pharmacist connections have been an incredibly pivotal opportunity for us to create connections. In 2014, the Pennsylvania Pharmacists Board of Directors approved the engagement of a pharmacy resident in partnership with the University of Pittsburgh in order to provide daily continuity of engaging community pharmacies in our network and offer training statewide. This first resident, Brandon Antonopoulos, fostered growth of training and established the need for a permanent PPCN position. In January of 2016, Pitt Pharmacy hired Mindy Kosminski in partnership with the Pennsylvania Pharmacists Association to serve as the first PPCN executive manager and lead the daily operations of the Pennsylvania Pharmacist Care Network. Her leadership led to our first payer engagement, and soon after, we were able to then hire Stephanie McGrath, who joined us and continues to lead PPCN today as our executive director. The leadership of these individuals and the continued leadership of Stephanie McGrath have put us in a position to be able to have numerous patient care contracts that I'm going to tell you about and to lead us to where we are today. This was lesson number 6. Creating educational opportunities like residency and fellowship programs can lay the foundation for building a practice and building a network. Bridging the opportunities between academia and patient care needs creates incredible infrastructure to get things started. To keep things going, you need permanent personnel. In 2016, pharmacies that had employed PPCN pharmacists were invited to sign a participation agreement that provided the ability for the network to speak with payers on their behalf. Value Drug Company joined the Pennsylvania Pharmacists Care Network and Pitt Pharmacy in recruiting independent pharmacies to join the network. We also began evaluating electronic documentation systems for their readiness to partner with a payer. We have a huge thanks to David Pope and his team, that was Creative Pharmacist, now known as Omnisys Strand, who partnered with us to launch the first Pharmacist e-care plan and partnered with us to create the opportunity with our very first payer. This was lesson number 7. We learned you need the practice to be designed and pharmacies to be contracted and documentation, Pharmacist e-care plan, in place before you can contract with a payer. We did this, and in 2017, PPCN and Strand collaborated to launch the first payer contract for comprehensive medication management with a Pennsylvania Medicaid managed care organization known as the Gateway Health Plan. Gateway covered 3 of 5 Pennsylvania Medicaid regions, and Medicaid members who filled at least one medication at a PPCN pharmacy were eligible. A total of 61 independent pharmacy practices elected to participate in this first payer contract. The comprehensive medication management contract included payment for 1 initial patient encounter and up to 6 follow-up encounters in a calendar year for an individual patient. The University of Pittsburgh, the Pennsylvania Pharmacists Care Network, and the Pennsylvania Pharmacists Association worked together to facilitate this payer contract in partnership with Strand and Gateway. Strand's e-care plan platform served as the documentation system and facilitated billing for patient care encounters. This also marked the beginning of our partnership with CPSN USA. At the time, CPSN USA was forming networks nationwide. Our partnership first began as consultation and ultimately led to the Pennsylvania Pharmacist Care Network fully integrating with CPSN USA as a clinically integrated network, along with the networks throughout the United States. The partnership with Gateway Health Plans served to provide an example to other CPSN networks. And we owe a huge thanks to Troy Trigstad and his entire CPSN USA team for their steadfast partnership at all hours and their belief in making change possible in community pharmacy practice. We are grateful and we admire the efforts of this team that we are proud to work alongside with each and every day. This was lesson number 8. Document your care, share your success. We all move together faster when we learn together. The University of Pittsburgh and our partners provided significant support for the implementation of what this first payer contract was. We learned quickly that we need to have a way to communicate and connect with pharmacists on a weekly basis in their practice. This is done through coffee and conversation, which is an online way to connect, but we also realized we needed a personalized way to connect, and we established something called the Quality Engagement Team at the University of Pittsburgh. This student-led team consists of students who are mentored by pharmacists and faculty who connect on a weekly basis with pharmacist leaders in their pharmacy. The Quality Engagement Team was first led by a group of students, including Sophia Herbert and Kelsey Hake, who lead it today. Both Dr. Herbert and Hake are currently fellows at the University of Pittsburgh who work with a group of students and mentor them in partnering out with pharmacies and connecting with them each and every week, making sure that there's bi-directional communication to the pharmacies and that the pharmacy teams have a way to instantly call for help and share their success stories. This was lesson number 9. Students can be leaders and teachers to support practice transformation. The ongoing cycle of learning the needs of patients, practitioners, and payers continued. And in 2018, Professor Kim Coley and Joni Carroll, who are at the University of Pittsburgh, received the Eugene Washington Engagement Award from the Patient-Centered Outcomes Research Institute, titled a statewide community pharmacy research network that aligns patients, pharmacists, and researchers. This allowed us to formally establish a research network affiliated with the Pennsylvania Pharmacist Care Network. The award gathered perspectives from pharmacists and patients about how patient-centered outcomes research could happen in collaboration with pharmacies. This was lesson number 10. A pharmacist patient care network can be a research network. There's a richness to the experience and data produced by the pharmacist provided patient care. And when it can cycle back to the pharmacies in nearly real time, it can help them to improve the work and the care that they provide to patients every day. The strong connection between the University of Pittsburgh School of Pharmacy and our 6 additional schools in Pennsylvania with the Pennsylvania Pharmacist Care Network was recognized by CPSN USA. And thanks to their advocacy and their support, in 2018, we were awarded a grant from the Community Pharmacy Foundation in partnership with CPSN USA and the American Association of Colleges of Pharmacy to lead an initiative to facilitate partnerships between CPSN networks and colleges and schools of pharmacy throughout the nation. We established the Academia CPSN Transformation or ACT Pharmacy Collaborative. Today, this collaborative includes 93 colleges and schools of pharmacy from across the country whose deans have committed to prioritizing and supporting community pharmacy practice transformation at their institutions. ACT serves also as an engagement point for the national associations to connect with leaders in academia. The National Community Pharmacists Association, American College of Clinical Pharmacy, AACP, and the American Pharmacists Association share their insights, supports, and connections with faculty on a regular basis. In 2019, CPSN USA and the Community Pharmacy Foundation partnered to launch a nationwide community pharmacy practice transformation initiative called Flip the Pharmacy. As you might have guessed, the Pennsylvania Pharmacist Care Network, Pitt Pharmacy, and Value Drug came together with the Pennsylvania Pharmacists Association to be Pennsylvania's practice transformation team. We're proud to report that this team has engaged numerous pharmacists and pharmacy teams from throughout the Commonwealth and was awarded the Flip the Pharmacy Team a year in 2021. These pharmacists in the very first year alone submitted over 30,000 care plans, including the identification of 16,000 medication-related problems. With the onset of the COVID-19 pandemic in 2020, the Pitt Pharmacy team quickly mobilized to create a plan to support vaccines in the Commonwealth of Pennsylvania. We're proud to say that this process was facilitated by numerous collaboratives that had happened prior, and it was an important collaboration between the Pennsylvania Department of Health and a grant led by Professor Kim Coley with the CDC and the National Association of Chain Drugstores that set us up for this opportunity. Pitt Pharmacy and the Pennsylvania Department of Health had developed a memorandum of agreement in 2018 for a pandemic for influenza. Little did we know that this memorandum of agreement was going to be set off a critical series of events, allowing our pharmacists and pharmacy teams in Pennsylvania to be among the first to be able to provide COVID-19 vaccines to the public. This important role put us in the position to have pharmacies in Pennsylvania provide over 250,000 COVID-19 vaccines to date. This important relationship also created an opportunity for students to be able to connect with these pharmacies statewide, and for the University of Pittsburgh's campus pharmacy, University Pharmacy, to serve as a hub for COVID-19 vaccines, particularly Pfizer, to get them out to pharmacies throughout the region. This was lesson number 11. Research grants lead to practice change. They are worth the effort and they create incredible connections. As PPCN continued to grow, both in size and impact, new partnerships have been forged with health plan payers. In 2020, PPCN launched 2 separate partnerships with regional health care plans for the provision of immunization services. In 2021, PPCN launched 2 additional Medicaid MCO contracts for the provision of patient care services. And to date, there are a total of 13 different payer engagements available to pharmacists in the network. We owe a special thanks to so many people. I'd like to thank Pat Epple, who recently retired from the Pennsylvania Pharmacists Association as the executive director. She was with us since the inception of PPCN. Her energy and her drive and dedication have led to so many opportunities statewide. A special thanks to the current PPCN Board of Directors, Nick Leon, Chris Anapas, Kristen Hartzell, Bill Thompson, and Tom DePietro, who I continue to be able to work along with, Stephanie McGrath, who leads day-to-day operations tirelessly, and Vicki Elliott, current executive director of the Pennsylvania Pharmacists Association, who continue to steadfastly guide the daily operations of the Pennsylvania Pharmacists Care Network. Community pharmacy practice transformation is an ongoing process fueled by collaboration. The Pennsylvania Pharmacists Association, the Pennsylvania Pharmacists Care Network, the University of Pittsburgh School of Pharmacy, and Value Drug are currently collaborating on legislative advocacy to establish pharmacists as providers of services and maintaining the COVID-19 waivers and testing in Pennsylvania. Pitt Pharmacy is actively working to analyze the Flip the Pharmacy care plan data, and we continue to work with all the schools in Pennsylvania to utilize the standardized training in their curriculum. Lesson number 12, real change takes all of us, a common vision and willingness to steadfastly work towards achieving that vision and celebrating along the way. The time for community pharmacy practice transformation has never been more critical for patients or our profession. Community pharmacy practice is the front door to health in our communities. We are proud to share our vision and our commitment beginning over 13 years ago that has resulted in patients receiving care in their local community pharmacies, from pharmacists who now have a business model to provide care on an ongoing basis. There is still more work to be done. Our collaborative team is ready to work alongside of all of you nationwide as we work together to pursue practice transformation, payer collaborations, advocacy, and research for years to come. We hope our story reminds you of the many connections you already have and have the opportunity to foster in your own states. Thank you for this incredible honor and the opportunity to share our story. We look forward to working alongside all of you.
Thank you, Melissa, for your outstanding lecture. Your work with the University of Pittsburgh and your partner organizations is inspiring to pharmacists across the country. We will now field questions from listeners. Staff, have we received any questions?